Hi everyone, I'm Dr. Shilpashree. I'm a consultant obstetrician and gynecologist, laparoscopic surgeon, and fertility specialist. I have my own clinic in Uttarahalli, Ramanjanagar. I am also a consultant in Cloud9 Hospitals, Dotkal Sanra, Kanakpura Road. Today I have chosen the topic pregnancy and its complete care. So I want to discuss about what all the things we need to do once a woman becomes pregnant. What is the care she needs to be given and also to be taken care by herself. So the first and foremost, as I always say, pregnancy is the most beautiful phase in a woman's life. It's a phase which completely transforms a woman from womanhood to motherhood. It's the most beautiful journey. It's a long journey. It's a 9 months duration journey. So the entire 9 months of pregnancy is divided into 3 trimesters. The first 3 months constitute the first trimester. The fourth, fifth, sixth months of pregnancy constitute the second trimester. The 7th, 8th and the 9th months of pregnancy constitute the third trimester. First and foremost, when you decide to plan for a pregnancy, the most important thing you need to do is visit your gynecologist. So why should you visit your gynecologist? The reason is, first and foremost, there might be so many health issues we might actually not notice. And once we plan up and if the pregnancy is not happening or we undergo a miscarriage, that's when we approach a gynecologist. But actually, well before you get a thought of planning for your pregnancy itself, you should meet your gynecologist. When you meet your gynecologist will completely screen your health as well as your partner's health. Check out if any diseases, especially the hereditary diseases like diabetes, thyroid, blood pressure, thalassemias, or any other genetical disorders are running in the family, and also test you for the same and see if you are a carrier of that particular disease. And the other thing is, in case if you are having PCOD issues, the most important thing is to regularize your periods before you actually plan for conception. Why you have to regularize your periods is, PCOD patients will have more chances of, first and foremost, not conceiving. Second is chances of miscarriages as well as becoming diabetic during the journey of pregnancy. So when you meet your gynecologist well before you actually become pregnant, the gynecologist will completely screen your health and give you certain medications if required, and also guide you on the healthy lifestyle habits, the diet habits, which actually help you in conceiving in a healthy way and delivering a healthy baby. So the most important thing during the preconceptional period is consumption of folic acid. Any folic acid which is available in market is the best, but the one with DHA plays a vital role in having a healthier pregnancy. So start taking folic acid as soon as you plan for your pregnancy, and meet your gynecologist as soon as you miss your first month period. The reason you meet in the first month itself, once you miss your period, the earlier you meet actually, it's better, because the gynecologist sees how healthy the pregnancy is by doing a blood test called beta HCG, or sometimes even an early pregnancy scan to see if the pregnancy is well formed within the uterus, or is there any chance of ectopic pregnancy. So what is this ectopic pregnancy? Ectopic pregnancy is nothing but the pregnancy developing outside the uterus. It can be in the fallopian tubes, it can be in the ovary. So if you meet your gynecologist as soon as you miss your periods, and once your pregnancy is confirmed with a urine pregnancy test, which can be actually done at home, this gynecologist will do the necessary blood test and the scans if required. So what are the things to be done in the first trimester? Consumption of folic acid, which is very, very important. Some women do have excessive nausea and vomiting. So there are certain medications which will be given to you by a gynecologist, which are very safe for you as well as your baby, and prevent you from having excessive vomiting and nausea. The reason why the medicines are given is excessive vomiting and nausea itself can lead to pressure on the uterus and miscarriages. So do not ignore if at all you are having excessive nausea and vomiting. Talk to your gynecologist and she will definitely be giving you a safer medicine. So, a early viability scan is done at around 6 to 7 weeks. What is this early viability scan? Before I talk about that, I would like to tell throughout the journey of pregnancy, 5 important scans are done. The first scan is done between 6 to 7 weeks of pregnancy, the second scan at 3rd month, third scan at 5th month, fourth scan at 7th month, and fifth scan at 9th month. Usually, we stick on to only 5 scans. But in some cases, if at all we feel the pregnancy is a little complicated, or if you ever had a bleeding episode or pain abdomen, we can do 1 or 2 scans extra to see if the fetus is happy and healthy inside. Let me tell you, scan is never harmful to you or your baby. Scans are not radiations, they are just sonic waves. X-rays and MRIs are radiations and they are harmful. So this X-ray and MRI should be avoided. Scanning will never harm your baby. There are some age-old myths and old people say at home saying, do not go for scans so frequently. It causes a problem to your fetus. But I'm making it very clear to you, scanning is never harmful to your fetus, not to you. In fact, it gives us more information what exactly is happening inside your uterus, how healthy your fetus is growing, how healthy the blood circulation is going to the baby from the mother. Scan gives us a lot of information. So 5 scans are mandatory throughout your pregnancy, and as I told you, 1 or 2 scans extra or 3 scans extra in case if it is a high risk pregnancy or a complicated case. Like in case you were having severe vomiting, you might be having pain abdomen, and that's where we rescan to see if everything is fine within the uterus or if you have developed any bleeding within the uterus because of the excessive pressure exerted during the vomiting episodes. So the first trimester, the consumption of folic acid, early viability scan is done. Once the scan is done at around 6 to 7 weeks and your baby's fetal heartbeat is confirmed, we do something called the antenatal profile blood test. This blood test consists of checking on your hemoglobin, your thyroid status, your diabetic status, your blood group, your urine analysis to see if you are having any urine infections, and your sugar levels. So these are the most important blood tests to be done in your first trimester itself. The reason is earlier we detect if at all you are having any thyroid issues or diabetic issues. If we detect earlier, we can actually start your medications and prevent you from undergoing a miscarriage or abnormal growth of the baby. So always after the viability scan, I suggest all my patients to do an antenatal profile blood test. So this is all about your first trimester. I tell my patients to avoid as many medicines as possible in the first trimester, that is during the first 3 months of pregnancy, because 90% of the baby's growth happens in the first 3 trimesters. So any medicines you take without the advice of your gynecologist can actually have an adverse effect on the baby's growth, and it might lead to abnormal babies. So before taking any medicine, speak to your gynecologist and confirm whether it is safe. The other things what I tell to avoid during the first trimester is to avoid traveling during the first trimester. Excessive traveling during first trimester. See, in the olden days, people used to say, till they complete 3 months, they used to never disclose the pregnancy. The reason behind that, or the scientific reason behind that, is up to 3 months, no pregnancy is guaranteed. Because what happens is, the chances of abortions, miscarriages are very much high during the first 3 months of pregnancy. So, I always tell to be very careful during the first trimester, that is the first 3 months of pregnancy, to avoid excessive traveling during that period, and also to avoid taking any medicines without your gynecologist advice. The other most important thing is I also advise my patients to restrict intercourse during the first trimester, since the fetus is very low in the uterus, almost in close contact with the vagina. Any excess exert pressures during the intercourse or during traveling can actually have some adverse effects on the fetus. So refrain yourself from intercourse during your first trimester. The food to be avoided during your first trimester or most of the time during your pregnancy is papaya, pineapples, jackfruits, to a certain extent mango and grapes. These are the things which I tell my patients to avoid in the first trimester because there are some studies which have proven that these may actually lead to miscarriages. Mangoes and grapes, what happens is they causes excess heat production in the body and this might also lead to bleeding tendencies. So that's the only reason I tell my patients to avoid these fruits during the first trimester. So once you are at around 12 to 13 weeks, that is towards the end of your first trimester, the most important scan called NT-NTD scan is done. This scan is also called as the first anomaly scan. As I told you already, during the end of the first trimester, the baby's 90% growth is completed. This scan detects any abnormalities in the physical appearance of the baby, any abnormalities in the internal organ development of the baby. This scan is very, very important. This also tells us whether the baby is also normal or having any other physical organ abnormalities. Post this NT-NTD scan, I suggest my patients to go for a double marker test or a dual marker. The importance of this blood test is to screen for Down syndrome. This is also a very important test and should never be missed. Once NT-NTD scan is done, a double marker is suggested, and post that I always give an injection of tetanus. So one more thing is, throughout the pregnancy of 9 months, 2 tetanus injections are given. Usually I give that after the completion of the first trimester or after 3 months, the second during the 5th month. So this is all about your first trimester. Monthly visit to your gynecologist is very much required, and analyzing your hemoglobin, your urine as well as the sugars at every visit is very, very important. The reason is the mother tends to become anemic during the pregnancy because most of the blood flow is directed towards the fetus. So the mother's hemoglobin might go low and the chances of urine infections are quite high during pregnancies. And as we are Asians, we are more prone to become diabetic. So checking your glucose level at every visit is also very, very important. So these are the things during your first trimester. So once you're done with your first dose of tetanus injection, next comes the second trimester. Second trimester is called as the honeymoon period in the pregnancy. 4th, 5th and 6th month is quite a safe period and it's quite safe to travel. You can also refrain to your intercourse activities if you are comfortable. And the most important scan in the second trimester is your anomaly scan. Anomaly scan is a scan which is done to detect any fetal abnormalities in your baby. This scan is usually done between 18 to 22 weeks. So there is something called early anomaly which we do it at as early as 18 weeks and late anomaly which we do it at 23-24 weeks to see if at all there are any abnormalities in the organs of the fetus. A detailed scan is done checking each and every organ in detail by a fetal sonologist, and she will be doing a scan. So after the completion of the anomaly scan, the second dose of TT injection is being given to the mother. Now coming to the last trimester, that is 7th, 8th, 9th month scheme. This 7th, 8th, 9th month period is called the third trimester. The most important phase is the baby starts growing really at a faster rate in this third trimester. So the mother's food requirement equally increases. The iron and calcium consumption also increases. And one more thing which I have missed is, usually once the NT-NTD scan is done or after the third month, the gynecologist will be giving you iron and calcium supplement to make sure you do not become anemic and have a good calcium supplement in your body so that it promotes the growth of your fetus bones in a healthier way. So taking iron and calcium for 6 months is very, very important. How much ever healthier you are, do not ignore these supplements. They are very much required because the tendency of mother becoming anemic is very high during the pregnancy. So from 3rd month till you deliver as well as post delivery, I suggest all my patients to take calcium and iron tablets at least for 6 months. The more the iron and calcium, the more healthier you are and more healthier your baby is. So now I was talking about the third trimester, which is 7th, 8th and 9th month. this 7th, 8th and 9th month is quite a crucial phase because the baby is growing at a faster rate, and we also would like to analyze how fast and how healthy your baby is growing. So at around 28 to 30 weeks, I suggest a growth profile scan just to monitor what is the growth of the fetus at this particular time. Is your baby growing really healthy? Is the blood circulation from the mother to the fetus healthy enough to promote the growth of the fetus? So this is called a growth profile scan, which is usually done between 28 to 30 weeks. And the last but not the least scan is done usually just some 10 to 15 days prior to your delivery to analyze what is the estimated fetal weight of your baby. Are you suitable to undergo a normal delivery or a cesarean? Is the fluid around the baby also adequate enough to give a cushioning effect and a smoother growth for the fetus? So what do we check in this last scan is the weight of the baby. Is the baby's weight good enough, or it is more, or it is less, or is there any abnormalities in the blood circulation from the mother to fetus, which is called as a fetal Doppler, as well as the fluid around the baby, which is called the AFI level. It should not be too much, not too less. So these are the most important scans and the things to be done during your pregnancy. Now coming to the food, see, a mother usually requires extra 500 calories more throughout the pregnancy. Too much overeating and too much less eating is really harmful for the baby. So many people have a myth or an assumption, if the mother is really growing fat, the baby is also going to be chubby and fat, but that's actually a myth. Let me tell you, we don't want the mothers to grow fat. We want the baby to be growing healthier and in a uniform rate. So what I tell you is, do not overeat anything. Do not undereat also. Eat lots of fruits, vegetables. 2 glasses of milk every day is very, very important. 3 liters of water is very, very important. Eat lots of palak, beetroot, pomegranates. These boost up your iron levels. Have lots of citrus fruits, especially oranges, kiwi, musambis. These are very rich in vitamin C and they are natural immuno boosters. The other fruits, what all you can eat, you can definitely have watermelon, muskmelon, apple, small bananas. They are very, very good. Eat a lot of green leafy vegetables. If you're a non-vegetarian, you can have non-veg twice a week and eggs every alternate day. I think this much is sufficient for a mother to be healthier to deliver, and also for a healthier fetus and to deliver a healthy baby. Thank you. If you have any doubt and if you would like to meet me or consult me, I do provide online video consultation. You can always WhatsApp on 9739463172 for any online video consultation or for my clinic related queries or even for my hospital related queries. Thank you.